Hello everyone. In this video, we will talk about pain in the lower back, sacral area, or buttock area during prolonged walking, which most often occurs on one side. In most cases, this is related to excessive pelvic rotation, which is very difficult to assess and correct. For this, the following exercise will work for us. We stand close to some kind of support. This could be the edge of a sink, something straight so you can see yourself better in the mirror or any table, as long as it's roughly at the height of the upper third of your thigh, but not above the crease line. We stand close so that our knees are straightened until we feel the weight start to shift from the balls of our feet to our heels. After that, we need to make sure our legs are in line and our feet are parallel, not turned out. After that, we place our hands on our pelvic bones and start to slightly rotate the pelvis, as if we're trying to bend the lower back. But basically, you don't need to move, just tense your glutes with a slight adjustment of the pelvis. In most cases, you'll feel like you're starting to lean back onto your heels and instinctively tilt forward. All we need to do with this adjustment is to connect the shoulder blades while maintaining the position of the pelvis. You can even do this with your hands, slowly starting to straighten up without losing your balance. At first, your toes might come off the ground, but with repetition after repetition, we need to fully straighten the legs in line with the body. Once you master this movement without leaning back, you can make it more challenging by bringing your shoulder blades together by moving your elbows back. We also get into the correct position and start accompanying the movement with the chest, similar to taking a deep breath. It's very important that your pelvis doesn't make any unnecessary movements here. And the third level of difficulty. When we start lowering our arms, after moving the pelvis, we straighten up and slowly begin to raise our arms in front of us, lifting our head by raising the chin, not by tilting the back of the head. During this movement, it's important for us to keep the pelvis position so that the weight doesn't shift onto the toes. And we make sure that the arm lift is even throughout the entire range and volume. At the same time, it's very important that on the way back, the weight doesn't try to shift onto the toes. These movements should be performed very slowly. It's best to do about 7 to 10 repetitions per set and repeat this 3 to 5 times throughout the day. As soon as you master one level of difficulty, try to move on to the next right away. The essence of this exercise is to stabilize the pelvis. In fact, we fix the pelvis by touching the thighs, and in this way, pelvic instability with fixed lower limbs will most often be expressed as rotation of the torso. And by monitoring through your hands or elbows, you'll be able to feel that the movement starts to become uneven, tilting to one side. It's this one-sided component that you need to control, and by actively resisting with your muscles, you should align yourself so that the movement happens symmetrically on both sides.